Talk Radio 640 WGST.
Welcome back, and if you're just tuning in, you're listening to HealthTech Talk, broadcasting from iHeartRadio Studios, 640 WGST, and streaming worldwide on the iHeartRadio network. All right, we had an incredible first guest today. We have two little segments left, and the first guest on this second segment is Steve Marin, MD, Chief Medical Officer of U.S. Medical Management. First, I have to tell the audience, I've known Steve for several years. Steve is what I can truly say is not only a doc, but he's always been a true innovator in the world of digital, mobile, e-health. He was doing it before there was even a term for it. Steve, welcome to the show. How are you today?
Thanks, Ben. Doing very well right now. Thanks. And thanks for that introduction. It's I don't know if I can hold up to that, but we'll give it a try.
No. Well, you'll definitely be able to hold up to it because you've done it all. And I've always been very impressed with you. I like to consider you not only an expert in the field, but someone that I'm friends with. So it's an honor to have you on the show. All right, I want to start off before we jump into all this, because I had a really fascinating guest on before. What is your favorite app now, a healthcare-related app? Well, actually, I'm going to broaden it. It doesn't have to be healthcare. Healthcare or technology, app or device. What are you addicted to these days?
Oh boy, I just moved, so I'm more into Yelp than ever, and I'm actually finding we have I work at a company called U.S. Medical Management, which is based in the Midwest. We have a 200 physician practice and about 50,000 patients, and many of our patients are elderly, and as I interact with Yelp in particular, because again, we just moved to this new neighborhood. I don't know anything around. I don't know where to go shopping. I don't know where to buy food. I don't know where to get things for my kids. And I'm seeing that there are ways that I could interact with my caregivers, the adult children of the elderly patients that we care for, using some of the things I'm learning from Yelp even differently than some of the major healthcare apps that are out there. The other thing, the newest one that I've gotten is a new app called Noisely. And it's basically a white noise background music. So if I'm actually sitting and having to do work, rather than have the music on in the background, it creates these incredible patterns, musical patterns in the background, which is kind of like having the TV on, except you don't actually have to pay attention to the words that are being said. So that's what's prominent on my iPhone right now.
See, I think that's really cool. I love that you came up with, you showed me two things that I didn't expect you to say. I actually wrote down Noisely. I'm going to do it. I'm going to see if it helps me concentrate more when I'm doing work and it blocks out the background sounds. And I think that's really cool. All right. Tell me a little, Steve, about your company, U.S. Medical Management, where you are the Chief Medical Officer. How to get started? How long has it been around? And you said a number that sort of blew me away. Did you say you had over 50,000 patients or something like that?
50,000 patients in 14 states around the country. It's a Michigan-based company. The brand we're known by in the community is Visiting Physician Association in 44 cities around the country. The company was founded 20 years ago by a 20-something-year-old man who was really concerned about getting care for his grandmother. And he would have to leave work and go home and pick up his grandma and take her to the doctor, and then they have to wait 45 minutes in the exam room, and then they'd see the doctor for all of 10 minutes, and on the way home, his grandmother would just be so happy with the 10 minutes she was granted by this doctor. But then for the next 2 days, she would be exhausted because of the physical stress of leaving her house and having to go to the doctor's office and all the waiting time and the getting undressed and moving around. He found a physician who was actually working out of Detroit, who was doing kind of house calls for patients who couldn't get to the doctor on her own. And he made an arrangement with her to become his grandmother's physician during this particular end phase of her life. And that was so successful that Mark, who again was in his 20s at the time, and Dr. Del Pilar, who was I think probably in her 50s at the time, this is 20 years ago, formed the first Visiting Physician Association. And that was the beginning of this company. And what I love about working here is that, it's always great to work with a founder who started started the company from something that connects to the family. Yep. This was not, an engineer who had a big idea about how to design a product. This was, we really need to do something to help people age in place, to be at home, and in many ways discovered a patient-centered care model, which is what do we have to do to keep people in their home and to provide care around their home without forcing them to be transported. Well, 20 years later, U.S. Medical Management is, again, now 40 cities around the country, wow. 200 docs. And we're really starting to get into the issue of population health and accountable care using technology, but using technology in support of human services. So,
Steve, let me interrupt for 1 second, Steve.
Sure.
Tell my audience, because not everyone knows. First, what is population health? And then also I want to give a little comment that I think it is really important that anyone out there who's a young entrepreneur starting it, have a passion first and the money will come. But if you're not passionate about it, it will never come.
I think that's absolutely true. So, we're hearing a lot about changes in healthcare right now and the way healthcare is paid for. And what population health is shifting, from my perspective, I'm old enough to remember when doctors took full responsibility for their patients. These are my patients. I take care of them. The idea of population health is to say to a doctor, you're going to take responsibility for this group of patients, and we're going to pay you based on the quality of care and the health status, how healthy they become over the time you take care of them. So rather than generate a bill, I did this procedure, I did this test, rather than that become the basis of the billing, it's basically, doc, do whatever tests you need, provide whatever services you need, and we're going to pay you based upon how healthy you're able to keep that population. And that's really what this whole thing about accountable care organizations and population health really is all about.
Oh, so the timing for U.S. Medical Management is sort of ideal. So I got a question for you. Do the general consumer that's listening, do they reach out to U.S. Medical Management, or is it all through the insurance companies and the payers and the providers?
Actually, no. If someone is an adult and their parents need care and their parents are really homebound, they are welcome to call the Visiting Physicians Association or go to the Visiting Physicians Association website and initiate an entry. We'll walk you through it. We have a centralized patient access point, so you don't have to necessarily call the offices where you are. There's an 800 number, which I don't have right in front of me, but I'll get in a second. I wasn't thinking about this as being a place to kind of promote the service, but I think it's probably a good idea to let people know. This is something that you can call and get an assessment and find out the best way to, because the patients who we care for really are homebound. So it's 877 house call is the number.
877 house call.
House call 468-7322.
Yeah.
It's interesting the best part about what we do is because we take care of people in their home, we tend to kick them out of the hospital. So many of the patients we care for, if they show up in an emergency room, the hospital goes, oh, they're sick enough that we can admit them. But we surround them in services. We have mobile laboratory services, mobile x-ray services. Again, we've got an electronic health record platform that is cross-state mobile. We have advanced clinical decision support platform. We have a big analytics platform. And but the focus here is really on the human service component.
And Steve, don't you really help with the institutions with, readmissions? If when they go home, if you're taking care of them and they're using an organization like yours, that they're not going to get readmission. And just for our audience knows, hospitals now, after they take care of you and they send you home, they can't have you come back, or they get sort of dinged on it. There's a financial ding on it. If they treat you and they make you healthy, you're supposed to go home, or relatively healthy. So your organization sort of fits right in there also.
That's exactly right. Because we're focused on allowing people to age in place and keeping people in their homes, our 30-day readmission rate, as you say, that's really the indicator is 30 to 40% lower than most large hospital systems.
That's amazing. All right, I want to do a little segue. So I understand from a couple of people told me you signed a book deal and you're coming out with a book. Can you tell my audience a little secret, a little preview, and then obviously we're going to have you back on the show when the book comes out. But tell us about it.
Yeah. So there are a number of people out in the world right now who are thinking about this issue of population health. I'm certainly not the only one, and many with far better credentials than I from an academic perspective.
I don't know about that.
My career has always been about being as close to hands-on patient care as I can. And while I've moved over into this position of kind of physician leadership, I've learned a few things about the way how to deliver quality care, and I've learned many of them by making a boatload of mistakes. So whether it's mistakes or dead ends or blind alleys I've went down, I've done enough of them that I thought I had enough to share what I've learned with the professional community, with the community of physicians. So yes, I was able to get a publisher to say, you know, we'd love you to share what you've learned over the years, and this, we're looking at probably the September this year for the book to come out, and it's really a handbook mostly for professionals on how to set up these kinds of population health services. You know, again, a lot of people hear about accountable care and fee for value and insurance and healthcare reform and all those things, but you know, turning that into something that that actually helps people get healthier. And also, you know, because I know it's your interest, how to bring the technology into this. You know, there's a lot of emerging technologies that are focused more on the needs of people. Most of what we see today in terms of analytics, for example, are really brought in from business. So, you know, we've got a bunch of data.
Hey, Steve, I got to interrupt you for 1 minute. Sure. We're going to come back. I just want to tell everyone I need to take a break. I want to thank everyone at 1-800 Public Relations and Paul, our board operator, and we'll be back.
The twists and turns of the Auto Club 400 continue.
The NASCAR Sprint Cup Series is on the Motor Racing Network.
Jimmy Johnson, the dominant car all day, will not be going to victory lane.
Join MRN for the Auto Club 400, live from Southern California. Listen Sunday at 2:30 p.m. on the Motor Racing Network, the voice of NASCAR.
Your home for NASCAR in Atlanta. Talk Radio 640. WGST.
Hi, folks. Alan Thicke here, and you've probably heard, maybe from me, that if you owe the IRS money, they can do some scary things. Garnish your wages, levy your bank account, even seize your home or business. You add on the penalties and interest, and getting out of debt can seem impossible. Back taxes are for real. It's not a game. But the game changes when you have a team of tax experts on your side. The professionals at Optima Tax Relief can immediately protect you from aggressive collections. And for a limited time, the IRS is offering a tax debt forgiveness program. It's called the Fresh Start Initiative. With the help of Optima, you may qualify for a settlement that saves you thousands. Nobody knows the game better than the Optima team. Don't wait till it's game over. Let their experts coach you through this. It's a win-win. Call for your free consultation.
Call 800-354-2840. 800-354-2840. 800-354-2840. Some restrictions apply. For complete details, please visit OptimaTaxRelief.com.
Join host Ben Chodor every Saturday at 3 p.m. for HealthTech Talk. Technology is changing how healthcare is being delivered. Their special guests will talk about how healthcare, science, and technology are enabling patients the ability to take control of their own health. Join the conversation Saturdays at 3 p.m.
Hi, folks. Alan Thicke here, and you've probably heard, maybe from me, that if you owe the IRS money, they can do some scary things. Garnish your wages, levy your bank account, even seize your home or business. You add on the penalties and interest, and getting out of debt can seem impossible. Back taxes are for real. It's not a game. But the game changes when you have a team of tax experts on your side. The professionals at Optima Tax Relief can immediately protect you from aggressive collections. And for a limited time, the IRS is offering a tax debt forgiveness program. It's called the Fresh Start Initiative. With the help of Optima, you may qualify for a settlement that saves you thousands. Nobody knows the game better than the Optima team. Don't wait till it's game over. Let their experts coach you through this. It's a win-win. Call for your free consultation.
Call 800-798-2477. That's 800-798-2477. 800-798-2477. Some restrictions apply. For complete details, please visit OptimaTaxRelief.com.
Would you like an extended warranty with your new refrigerator, sir?
Ma'am, an extended warranty for your washer provides extra protection.
Well...
And what about an extended warranty?
An extended warranty is recommended.
An extended warranty?
No thanks. I have complete coverage with Total Protect.
An extended warranty is definitely something you should have, but buying a separate one for every appliance would cost a fortune. Now with the Total Protect Home Warranty, one plan can help cover the repair and replacement costs of up to 20 of your most vital home appliances. From your water heater to your refrigerator or your plumbing system, you can even choose to cover your electronics, like your computer or TV. At Total Protect, you'll have total control to personalize a plan to fit your needs and budget. When breakdowns occur, our 180-day workmanship guarantee provides total peace of mind mind. For free information and a no-obligation free quote, call Total Protect at 1-800-900-9460. That's 1-800-900-9460. 1-800-900-9460.
Ever have one of those days when the clutch in your brain goes out, your mouth won't work, and you cannot find a good attitude to save your life? Hi, this is Jeff Foxworthy. When I have a bad day, I try to remember those kids that I have visited who are fighting cancer. Their little bodies are weak from battling this dreaded disease and from surgeries and cancer treatments, but they're not sad or down. Incredibly, they have this great attitude that they're going to beat the tar out of this monster, childhood cancer. They believe they'll survive. In their courageous hearts, they believe we, the grown-ups, will do something about this monster. They believe and trust in us. If these kids have the heart to keep fighting and living, then the rest of us must have the heart to help them. Your donation to Cure Childhood Cancer will help fund the life-saving research for kids who are battling and believing. It'll make your day. Donate at curechildhoodcancer.org.
Bloomberg, the first word with Ken Pruitt. Monday morning at 5 on Talk Radio 640 WGST.
Welcome back, and if you're just tuning in, you're listening to HealthTech Talk, broadcasting from iHeartRadio Studios, 640 WGST, and streaming worldwide on the iHeartRadio network. I am Ben Chodor, and I have a really special guest with me. It's Steve Marin, MD. He's a doctor, and he's the Chief Medical Officer of U.S. Medical Management, and much, much more. Before I took a break, we were talking about his book that he's writing that's coming out soon. Steve, before we move on to the next topic, you didn't tell us, what is the name of the book going to be?
Well, we don't know what the name of the book is. So right now it's a handbook of population health management. But, you know, the publishers are like, that's the most boring title in the world, so we've got to think of something new. But fundamentally, it's really a handbook of population health management, largely for physicians and administrators to figure out how to set up the way they deliver care to focus on quality and on really making sure patients are satisfied with the way care is delivered. You know, one of the things that I've learned over the years, particularly as I moved from working in technology to being back in patient care, is that you can surround your practice or your patients with lots of technology, but if you don't keep the human factor, if you don't keep the humanity in care, people actually don't get better. So if you really want to manage people with chronic illness, you gotta share the work of worry about them. And I think that's one of the things I went to medical school for, and I know many of my medical school colleagues went there. You lose some of that along the way sometimes, and then you get to rediscover it. And I'm fortunate to work with about 200 docs right now throughout the Midwest at our Visiting Physicians Association practices who have really recaptured that.
Well, and with your book, I'm going to beg my audience, send us some ideas for Steve's book name, and maybe you'll win a prize. So, you know, send them in, and I'll pass them all on to Steve. All right, Steve, I want to jump onto one other thing. All right, so not only are you the Chief Medical Officer, you are a physician, you're writing a book, you are asked to speak all the time, but you also participate in an organization, I know I'm going to say it wrong, is it Doctors Talk, Doctors Video, where you create videos for other docs? Is this true?
The Doctors Channel, yeah. So you know, I've been fortunate to have known the two physicians who started the Doctors Channel, and they started it a few years ago, and they did it so that they could help doctors keep up with what's going on in the medical journals. You know, there's like 500,000 articles a month that get published in medical journals, and it's really hard to keep up with the latest findings. So they have a group of physicians who read the journals, and they pick the really most important articles, and then they do these very short videos to help docs rapidly understand what some of these new research findings are. And I'm now working with them to talk about some of these issues that we're talking about today, about accountable care organizations and healthcare reform and what that means for doctors. And really, the whole point of it is to help doctors and patients kind of recapture some of the energy and vitality that used to be in the relationship between doctors and patients. You know, I grew up in the era where our family doctor still made a house call. And I never forgot that experience of Dr. Lipton, who would come to our home and you know, take care of our family. And while we can't necessarily recapture that, although again at Visiting Physicians we do to a certain extent with certain patients, the commitment that Dr. Lipton had to us is something I really think I like to see our doctors recapture.
I love it. You're creating sort of the cliff notes or the movie trailer, the synopsis of the horror article. I love it. But when you talk about house calls, My family, my wife and I still have a doc who does house calls, is Dr. Howard Britt, and he is amazing. We're actually on the phone with him this morning. I think that is amazing. Concierge medicine to a whole new level. All right, I only have a couple minutes left with you, and I got to ask you. I got to ask you this question: if I brought you back on this show in 5 years from now, what are we going to be talking about? How's the world going to be different in 5 years from now?
Wow. I guess if I had my dream for that, I would say that patients are talking about their relationship with their doctors in ways in which that relationship is really a tight, coordinated bond. I think that, there seems to be a little distance in that now, and some of it is based upon the fact that people are made to wait or that you just don't have enough time. And if there's one thing I'd like to see really different 5 years from now, it's a sense that that patients have that the doctors really got their back and are really there for them.
That is great. Steve, as I'm signing off with you, any last words you want to give to us, to our audience, about the whole world of digital health and M-Health and everything out there?
Well, just that, the world of healthcare is changing dramatically, and change is hard for everyone, and but it looks like we're finally aligned and going in a good direction. So I think it's time to put a little bit more trust in the healthcare system and see where it takes you.
Thank you, Dr. Steve Marin, Chief Medical Officer of U.S. Medical Management. You are awesome. I can't wait till you're back on the show, and I can't wait till your book comes out, and hopefully one of my audience members comes up with the name. Have a great day.
Yeah,
all right, so
that'd be great.